What if getting the wrong health checkup after 70 could actually shorten your life? I know it sounds completely backwards. We've been told for decades, stay on top of your health, get screened, be proactive. And yes, some tests save lives. But here's what most people, even doctors, don't always say out loud. Not all checkups are helpful. In fact, some are downright risky, especially for older adults. They can lead to false positives, unnecessary stress, and even dangerous treatments or surgeries you never actually needed. And this isn't some fringe idea. More and more physicians, especially those who work with seniors, are beginning to speak up. They're questioning whether the one-size-fits-all approach to medicine is actually harming the very people it's meant to protect. In this video, we're going to take an honest, eye-opening look at 7 common health checkups that many seniors are better off avoiding. Checkups that even shockingly many doctors say they would decline for themselves at a certain age. After 70, your healthcare should do more than check boxes. It should honor your age, protect your quality of life, and empower you, not overwhelm you. If you care deeply about your health, but want to avoid being over-tested, over-treated, or over-medicated, this video is for you. We're not here to scare you. We're here to give you the real information so you can make decisions with confidence, clarity, and control. Let's get started. Number 1. The full body scan. Mistake. There's something appealing about comprehensive body scanning. Having sophisticated machinery examine you from head to toe, detecting every hidden problem before it becomes serious, sounds like intelligent prevention. But for seniors over 70, this approach often becomes more curse than blessing. While full body scans may seem proactive, their outcomes frequently trigger a domino effect of fear, invasive testing, and unnecessary surgeries that can reduce your lifespan rather than extend it. Full-body CT scans and MRIs aren't typical screening tools. These powerful technologies capture everything, including harmless abnormalities that would never impact your health or longevity. These incidental findings can become psychological time bombs. A small nodule here, a shadow there, and suddenly you're caught in endless follow-up appointments, biopsies, and specialist consultations, all pursuing something that might never have mattered. Why does this matter more after 70? Because aging bodies don't respond as they once did. A biopsy that would have been straightforward at 45 can now result in collapsed lung, infection, or weeks of recovery. Even routine procedures like remaining still for MRI can be physically exhausting or painful for arthritic joints. The emotional burden is rarely discussed. Seniors often carry the weight of worrying about possibilities rather than enjoying their actual health. Number 2. The colonoscopy trap. Colonoscopy screening has been hailed as the gold standard for preventing colorectal cancer for decades. However, once you reach 70, particularly if you have no symptoms or family history, this procedure can silently become more dangerous than beneficial. What once served as a life-saving intervention in your 50s and 60s can transform into a source of unnecessary hazard, anxiety, and potential hospitalization as you age. The procedure itself presents significant challenges. It requires comprehensive bowel preparation, full sedation, and the insertion of a scope deep into your colon. While manageable for younger adults, these risks escalate dramatically in older patients. The bowel preparation alone can trigger severe dehydration and dangerous electrolyte imbalances, particularly hazardous for seniors. The sedation medications used linger longer in aging bodies, potentially causing confusion, unsteadiness, and increased fall risk. Even more troubling is how many seniors over 75 find themselves undergoing follow-up surgeries or treatments after colonoscopy reveals small polyps that might never have caused any harm. These slow-developing abnormalities typically require 10 to 15 years to progress into anything serious. For someone in their 70s or 80s, those years may never materialize, yet the discovery creates alarm. It triggers a cascade of procedures, biopsies, repeat examinations, and sometimes partial bowel surgeries, all justified as prevention. But when intervention risks exceed benefits, prevention transforms into harm. Consider Isaac, an 82-year-old man who was active and mentally sharp. He was persuaded to undergo routine colonoscopy despite having no digestive complaints. During preparation, he became severely dehydrated. Following the procedure, he experienced grogginess and confusion, fell at home that evening, and fractured his hip. That single test resulted in months of rehabilitation, mounting medical expenses, and tremendous stress. The outcome? The examination found nothing abnormal. This isn't about criticizing medical professionals. They're following their training. But medicine continues evolving, and we must adapt accordingly. If you're over 70 without symptoms, it's entirely reasonable to decline colonoscopy. Non-invasive stool tests are now available that are safer, simpler, and effective for many situations. It's about evaluating the real cost, physically, emotionally, and financially, of subjecting your body to something that may provide no actual benefit. We must abandon the assumption that more testing always equals superior care. After 70, better care often means fewer interventions and more thoughtful decisions. You're not neglecting your health by exercising caution. You're respecting it. If you're still watching this video and finding these insights valuable, please comment number 3 below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Your support helps us continue creating good content to inform and inspire you. Now, let's move forward. Number 3. The overuse of cardiac stress tests. For decades, treadmill stress testing has been considered essential for detecting heart disease, especially in older adults. The reasoning seems simple. Challenge your heart and observe its response under pressure. But after age 70, this logic can backfire in ways many seniors don't realize until too late. What was once valuable in your 50s and early 60s becomes questionable and sometimes dangerous once you pass a certain age. Cardiac stress tests in seniors often produce false positives, results suggesting heart problems when your heart is actually functioning properly. These misleading results occur because our bodies naturally change with age. Arteries stiffen, blood pressure fluctuates more, and heart electrical patterns shift, none necessarily indicating disease. But stress tests can't distinguish this. They simply detect something unusual, potentially triggering fear and additional testing. This cascade can include angiograms, catheterizations, and sometimes stent placements or bypass surgeries, all carrying real risks. For seniors, these aren't minor concerns. We're discussing bleeding, kidney injury from contrast dye, and dangerous blood pressure drops. Surgeries become harder to recover from, and complications multiply. What begins as a simple treadmill test can end with hospitalization. Take Samuel, a 74-year-old retired soldier. He had no chest pain, shortness of breath, or fatigue, just a routine physical where his doctor, just to be safe, ordered a stress test. Results came back borderline, and he was referred to a cardiologist. 3 weeks later, he underwent angioplasty for a blockage that hadn't caused any symptoms. Within a month, Michael developed a severe catheter site infection, landed in intensive care, and spent 6 months cycling between hospital and rehabilitation. His quality of life never fully recovered. Was that treadmill test worthwhile? Many leading cardiologists and geriatric associations now advise against routine stress testing in asymptomatic older adults. They agree that without symptoms, no chest pain, shortness of breath, or unexplained fatigue, there's often no benefit and significant potential harm. Psychologically, checking your heart feels compelling. The heart seems central to our identity, life's drumbeat. Naturally, we want to ensure it's healthy. But wisdom comes into play here. Healthy aging isn't about chasing every potential problem. It's about listening to your body, maintaining independence, and avoiding medical overreach that takes more than it gives. Instead of jumping on office treadmills, focus on fundamentals. Daily walks, balanced nutrition, social connections, and stress management. These truly support your heart after 70, not machines, wires, or tests designed for younger people. If you're still watching this video and finding these insights valuable, please comment more below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Your support helps us continue creating good content to inform and inspire you. Now, let's move forward. Number 4. The drawbacks of routine colonoscopies. There's something unsettling about colorectal cancer. It often appears without warning, and when symptoms emerge, it can feel too late. That's why colonoscopies were praised as one of medicine's most important preventive tools. But here's the reality many aren't told. After a certain age, particularly beyond 70, colonoscopy risks often outweigh benefits. For some seniors, this test causes more harm than good. The procedure requires full sedation, and for older adults, anesthesia carries serious risks. Your liver processes medications more slowly with age, and your brain becomes more sensitive to sedative effects. Older patients face greater risk of post-operative cognitive dysfunction, lingering confusion, memory problems, and brain fog lasting weeks or months after the procedure. Then there's bowel preparation. If you've had a colonoscopy, you know this part, drinking large volumes of powerful laxatives that flush your system. For seniors, this process can be dehydrating and disruptive. It disturbs electrolytes, affects kidney function, and can leave you feeling drained physically and emotionally. One misstep and you're dizzy, lightheaded, maybe falling in the bathroom at night. Falls related to colonoscopy preparation are more common than people realize, especially among seniors living alone. Perhaps most overlooked is the time horizon of benefit. Colonoscopies detect slow-growing polyps that might, over 10 to 15 years, develop into cancer. But if you're already in your 70s or 80s with prior clean screenings, the odds of those polyps becoming dangerous during your remaining years are extremely low. Many medical associations now state that potential benefits become marginal, while complication chances, bleeding, perforation, adverse drug reactions, increase significantly with age. Take Linda, a 78-year-old retired nurse. She had clean colonoscopies at 68 and 73. At 78, her doctor suggested one more, just to be safe. She agreed. During the procedure, her colon was accidentally perforated, a rare but serious complication. She underwent emergency surgery and spent nearly a month hospitalized. Linda survived but never regained her energy, and her independence diminished. She often wishes someone had warned her the test might not be worth the price she paid. Why does this happen? Partly medical habit. If something worked at 50, it must still be good at 75, right? But aging changes the equation. What once protected us can later burden us. Fear of cancer, while valid, often leads people to overlook their real goals, staying mobile, mentally sharp, and emotionally well. Number 5. Overuse of routine cardiac stress tests. Heart disease feels like a ticking time bomb. You hear stories of someone appearing healthy one day, then suddenly collapsing the next. It's natural to want early detection. That's why cardiac stress tests, treadmill or chemical tests monitoring your heart's response under pressure have become so common, especially among people over 70. But here's the surprising truth. For many seniors, particularly those without cardiac symptoms, these tests do more harm than good. The stress test idea sounds reassuring. You walk on a treadmill, they monitor your heartbeat, and if something appears problematic, they take action. But reality is more complicated. Most people over 70 already have age-related cardiovascular changes, mild arterial stiffness, some plaque buildup, or slower recovery after exertion. These are often normal aging signs. But when they appear on stress tests, doctors may interpret them as warning signs, prompting further testing and unnecessary procedures like angiograms or stent insertions. That's where things become risky. Follow-up procedures aren't without consequences. Catheterizations can cause bleeding, stroke, or kidney damage, especially in older adults with fragile blood vessels and reduced kidney function. Once you start down that path, it's hard to turn back. One test leads to another, then another, and before you know it, you've undergone a cascade of interventions for a condition that may never have caused problems. Consider James, a 76-year-old grandfather from Texas. He felt fine, walked daily, played with grandchildren, no chest pain or shortness of breath. At his annual checkup, his doctor suggested a stress test just to be sure. The test showed a minor abnormality leading to cardiac catheterization, which revealed some non-obstructive plaque. Doctors placed a stent anyway. After the procedure, James developed blood thinner complications, was hospitalized with internal bleeding, and spent 3 months recovering, all from a test he didn't need, based on a problem that wasn't urgent. Why does this happen? Partly fear. Fear of missing something, fear of what might happen if we don't act. But at this life stage, it's important to focus on quality over quantity, preserving energy, independence, and comfort rather than chasing problems that haven't materialized. Many respected cardiologists now advise against routine stress testing in older adults without symptoms. The evidence isn't strong enough to support it. It doesn't reduce heart attacks or lower mortality. For those without active signs like chest discomfort, shortness of breath during minimal exertion, or dizziness, it's not only unnecessary, it's potentially dangerous. If you're still watching this video and finding these insights valuable, please comment number 6 below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Your support helps us continue creating good content to inform and inspire you. Now, let's move forward. Number 6. The mammography trap after 75. Breast cancer screening through mammography has saved countless lives, but like many medical interventions, its value changes dramatically after age 75. What was once a crucial early detection tool can become a source of unnecessary anxiety, painful procedures, and diminished quality of life for older women. The problem lies in the changing landscape of risk and benefit. Most breast cancers found in women over 75 are slow-growing and unlikely to become life-threatening within their remaining years. Meanwhile, mammography's false positive rates remain high. Up to 10% of screenings lead to additional testing, biopsies, and procedures that ultimately find nothing dangerous. For older women, these follow-up procedures carry amplified risks. Biopsies can be more painful and take longer to heal. The stress of waiting for results, the discomfort of additional imaging, and the potential for complications all take a greater toll on aging bodies and minds. Consider Dorothy, an 81-year-old retired librarian. She had regular mammograms for decades without incident. At 81, her screening showed an area of concern. She underwent multiple additional imaging sessions, a painful biopsy, and weeks of anxiety. The final diagnosis, a tiny area of abnormal cells that, according to her oncologist, would likely never have caused problems in her lifetime. But the process left her drained, fearful, and questioning whether she should continue screening. Many major medical organizations now recommend individualized decisions about mammography after 75, considering overall health, life expectancy, and personal preferences. For women with limited life expectancy due to other health conditions, the stress and potential complications of breast cancer screening may outweigh any possible benefits. The key is honest conversation with your healthcare provider about your goals, your health status, and what you're truly trying to achieve with continued screening. If you're still watching this video and finding these insights valuable, please comment number 7 below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Your support helps us continue creating good content to inform and inspire you. Now, let's move forward. Number 7. The bone density scan overreach. Osteoporosis screening through bone density scans, DEXA scans, seems like a logical way to prevent fractures in older adults. But for many seniors, particularly those over 80, these tests often lead to treatments that may cause more problems than they solve. The issue isn't the test itself, it's what happens afterward. Bone density scans frequently reveal osteoporosis or osteopenia, mild bone loss in older adults, which is often a normal part of aging. However, these diagnoses typically trigger prescriptions for bisphosphonate medications, which come with their own risks. These osteoporosis medications can cause severe side effects in older adults, including jawbone death, osteonecrosis, unusual fractures, and digestive problems. For many seniors, the risk of these medication-related complications may actually exceed the fracture risk the drugs are meant to prevent. Take Patricia, an 83-year-old woman living independently. Her routine bone density scan showed osteoporosis, and she was prescribed a bisphosphonate. Within months, she developed severe jaw pain. After dental work, a section of her jawbone died, requiring multiple surgeries and months of pain. The medication meant to protect her bones had caused a rare but devastating complication. The reality is that for many older adults, especially those with multiple health conditions or limited mobility, fall prevention strategies like balance exercises, vision checks, and home safety modifications may be more effective than bone density testing and medication. Rather than focusing solely on bone density numbers, the emphasis should be on maintaining mobility, strength, and balance to prevent falls in the first place. After all, strong bones don't matter much if you're not falling, and weak bones can still support you if you maintain your balance and stability. Growing older doesn't mean becoming helpless. If anything, it's the time when we're finally wise enough to question the system, to slow down and ask, is this really for me? In a world that glorifies more checkups, more screenings, more medications, sometimes the bravest choice is doing less. Not out of neglect, but out of deep understanding, out of knowing your body, your values, and your goals at this stage of life. Healthcare in your 70s and beyond shouldn't be an automatic conveyor belt of tests and impersonal routines. It should be a conversation about what matters to you, how you want to live, and what risks you're truly willing to take. Blindly following protocols designed for younger bodies can rob you of energy, peace of mind, and even years of your life. Not because doctors mean harm, but because they're trained in a system that often chases disease instead of honoring health. Saying no to certain tests doesn't mean you're ignoring your health. It means you're being deliberate, weighing benefits against burdens, recognizing that not every test leads to clarity. Some lead straight into the maze of overdiagnosis, anxiety, and unnecessary treatment. Take ownership. Talk openly with your doctor. Ask whether the test is likely to change outcomes or just the paperwork. Think about your time, your energy, and your comfort. Because at this age, those are precious. You've earned the right to live on your terms. Not fearfully, but thoughtfully. Not overloaded with procedures, but empowered with knowledge. Not constantly preparing for sickness, but actively creating a life of meaning, joy, and connection. Thank you for joining us today. Leave a comment below, sharing one thing you learned and how you plan to use it in your life. Your thoughts are important to us. If you found this helpful, please like, subscribe, and share. Your support helps us continue creating content to inform and inspire you. Thanks for watching, and we look forward to seeing you in the next video.